This is Joan. She has been with our anticoagulation service, which is run by a pharmacist at our clinic for the past 5.5 years. We work with her primary care provider as we're in the same clinic and often are seeing patients on the same day to provide the best care that we can for our patients. Each visit includes a comprehensive overview of the patient's medications, looking at their health conditions and making sure that they're receiving appropriate therapy.
Pretty much, yeah.
Okay, we printed off some new ones, so I'm going to give you a blank med card that you can write all your medications on there and keep it in your wallet just in case of emergency. Thank you very much for bringing that. Okay, now our $1 million questions. Have you had any bleeding or bruising or cuts or falls or scrapes or anything that would be concerning for bleeding?
None.
None. Okay. Nosebleeds? I know it's getting winter and dry and...
No, that's fine too.
That's fine? Okay, good. You're short on air?
Well, that was Dr. Chabalowski.
Or you saw Chabaska. Okay, how is that? Are you feeling better? Are you still short on air?
No, I'm doing fine.
That's totally better.
Totally
better and improved. Okay. I'm going to go through your pills now. I know you know what you take, and you're very good at remembering your medications and what they're for. So I'm going to go through my list, and I want you to say yes or no, and kind of tell me how you take it and what you take it for, just so I can make sure my list is totally up to date.
Joan's care providers include a cardiologist, a pulmonologist, orthopedic surgeon, and her primary care provider. Besides helping her manage her anticoagulation therapy, our service has been able to help coordinate the changes in medications between all of these providers and make sure that she is giving safe care when she's had surgery, when she's had to be off of certain medications because of procedures and tests. All right, Joan. Well, how have medication management services working with Todd and Jen been helpful for you?
It's been wonderful. It's very important to keep up on your medications and your health conditions. And because a few months ago I had a problem with lisinopril, the lowest dosage even got my blood pressure very low. So I'm glad you guys caught it. It's very important to keep on top of your medication and your health problems. And rather than waiting for something to happen, then that's not the time to do it. It's time to keep up with it. So.
You had mentioned it's kind of nice to work with a team of both pharmacists and physicians and nurses. How has working with a team really helped you out with your health conditions?
Well, after I, as a patient, have you guys update everything, then you discuss it, and you guys are a team also, and you discuss it amongst each other and the doctor if you need the doctor's opinion and stuff. So you get other outside help, like if you need the cardiologist to come in and talk about my medications and my conditions and stuff, they'll help too. So you guys all work together, and that's great. As far as the warfarin is concerned, I'm always referring to your list to make sure, okay, which day do I take what, and I make sure I do it. So I said, okay, this is in the morning. I have my certain ones I take in the morning. Well, that I'd have an unused pill bottle. I put those 3 pills in there, and in the morning I just come in and take them, and then at night if I'm going to be away from home and don't know if I'm going to be home in the evening, I'll gather up my pills, what I need dosages and pills for that evening, and then I'll take them with, on the road. So, because I don't want to miss any doses,
All right, Joan. So, how has working with Todd or Jen kind of helped you out with your medical conditions?
Well, first of all, you guys, it's nice to have you guys that know us as patients, as personal. You know our records, you know our medications, you know our health, and the way I work it is I slip you guys an email or a call if I have any questions, and you're right there to help me, and that's very important. So I've come a long way, and I appreciate everybody here. So it's just not you two, it's everybody in the Painesville community. So it's wonderful to have you guys here. We appreciate it.